As COVID hospitalizations skyrocket and the island's COVID death count nears the triple digits, the already overwhelmed staff at the Guam Memorial Hospital search for ways to accommodate the influx of new COVID patients, as well as the number of expired bodies of both COVID and non-COVID fatalities. Hospital Administrator LILLIAN POSADAS.
The funeral homes are working with us and their families, with all the arrangements for the funeral services. So once those arrangements are complete, the funeral homes come pick up the expired bodies for, to make sure that they provide the dignified and respectful funeral services.
While funeral homes do what they can to cooperate with the island's public hospital, they find themselves working around the clock as well. Vice President of ADA's Mortuary, Tony Ada.
Would you believe that we have a funeral every day from now until November 14th?
Wow.
Yeah, that's what I'm saying, right? We have a funeral every day from now until November 14th.
Other funeral homes are experiencing the same rise in deaths this year compared to last year. Our Lady of Peace Funeral Home in Barrigada typically sees 750 to 800 deaths a year, and as of August 20th, the island's total deaths were recorded at 701. General Manager of Our Lady of Peace Funeral Home, FILEMON SUNGA.
Based on our records actually, as of September, we did 38 more than September last year. So definitely there's a rise in number of deaths on island.
Ada says that with the rise in total number of deaths, they're ready to help GMH with their morgue capacity.
As soon as they say that, we can pick up the remains, that's what we do immediately. We try to pick them up the next day if possible. Or, we do what we can to expedite the process.
But the lack of a full-time chief medical examiner has SUNGA concerned.
We're not supposed to pick up bodies there until they are seen by the CME. But because there is no CME, so that's why they are getting full capacity in the morgue. So sometimes they allow us to pick up when they are full already, and we do. We pick up even if before the CME examines, and then the problem is we have to return the body back to the CME for examination when the CME is back. And the CME does not come very often.
The Office of the Chief Medical Examiner falls under the temporary administrative purview of the Office of the Attorney General. And while they do not oversee the day-to-day operations of the CME, they remain on the search. According to AG spokesperson Carlina Charfras, the Office of the CME has existing contracts to meet the needs of the island while the search for a permanent CME continues. The contracts with the Office of the CME include forensic pathologists from Hawaii who fly in on an as-needed basis. There is also a contract with Dr. Dotterman, as well as a local doctor, to perform examinations and autopsies. Reporting for Guam's News Network, I'm Peter Santos.